Welcome to part 1 of Diabetes Prevention and Management class, Why It Matters. Today's session is on diabetes prevention and management. If you don't have diabetes, you can prevent it and you learn how to do that. Or if you already have diabetes, you want to be able to manage it so it doesn't get worse with complications. You'll learn that today and next week as well. It's a two-week class, basically today and then next week. And then also, before we get started, one of the things I wanted to find out is that for those of you who have not retired yet, my question is, what would you like to do when you retire? Okay, you can put it in the chat, things that you would like to do. Or if you're retired, what is one thing that you would love to be able to continue doing? All right. So just maybe half a minute for you if you wanted to write something down to everyone in the chat. I'll be able to kind of see what people's responses are, and then we can get started. So some of you indicated you would like to go hiking. You can, go dancing. You want to travel, right? Those are great things. That's some of the things I would, and some of you want to exercise and continue learning. Fantastic. So those are things a lot of people want to do, right? You want to stay healthy and you want to do things that you enjoy, right? And which means we need to be able to be mobile and move around. And then preventing diabetes is actually one of the important things that we need to be able to do if you want to enjoy retirement or do things that you continue to do things that you are doing now. All right. So today's class is diabetes prevention and management and why it really matters, because it really affects our independence and our ability to do what we want to do. And, the class is sponsored by Self-Help for the Elderly and the San Francisco Department of Disability and Aging Services. Today's class, I will discuss an overview of what is diabetes, right? And what are the risk factors? What are the symptoms, that you can recognize? Is there any symptoms, right? And then identify what are some of the things, methods, or strategies that you can do to prevent diabetes if you don't have it, or if you already have it, how can you manage it so that you don't get all the complications with diabetes? And then the next class, next week, we will continue to talk about some of the strategies. How can you avoid and prevent or manage diabetes? And then have an in-depth discussion so you can understand what are healthy carbs and what is glycemic load. Because if you understand this, I think that is the key to be able to manage and prevent diabetes. And then we'll talk about some healthy eating. How can you plan a meal that helps you stay healthy? And then cooking ideas, something that are simple ways to prepare food that is tasty, but also is healthy for you. And then some resources that you can do further reading and to help you get a better understanding of that. So diabetes, I'm sure many of you heard of that, right? Too much blood and too much sugar in your urine, right? That's how some people think of it, diabetes. Well, diabetes is actually a chronic health problem, and there is too much blood, too much sugar in your blood. But the good news is that it can be managed, and normal fasting blood glucose is 70 to 100 milligrams per deciliter. So a lot of people really, when you talk about that, it really doesn't know, well, what is 100 milligrams per deciliter? Let me just, actually, I wanted to double check my, like that. Okay, my virtual screen is not working right, which is fine. I think there's a lot of people using using the bandwidth right now. But in any case, let me kind of show you what it means when you have blood sugar that is normal, okay? So imagine this. This is 100 milligrams of this blood that is fairly normal. It's 100 milligrams per deciliter. It's very fluid, right? It moves around. Okay, this is actually fake blood. It's tomato sauce. But you can see that it's moving pretty easily. But as your body is not able to get rid of or use the excess sugar, your blood becomes thicker. Okay, this is 100 milligrams of glucose in your blood. So you can see it's kind of thick, right? It's harder for it to move around in your body. And as it gets higher, your blood actually will get thicker. Okay, this is 200 milligrams. You can see it's hardly even flowing, right? And in order for your body to actually push this blood, it actually has to use a lot more blood pressure. And, you know, it's much harder for your blood to really move this around and transfer and pass on the oxygen and all the other nutrients that your body needs to stay healthy. Another way to kind of look at this and how it damages your body is that there's a lot of organs in our body that has very fine, small blood vessels. And I am going to show you, sort of demonstrate as an example, how your kidney works. Okay? So I'm going to get a tablespoon of the normal blood, all right? And let's see. So imagine this is normal blood, okay? And then slowly, it's filtering, okay? Your kidney is filtering all the toxins and other things, excess stuff that doesn't need out of your body, and then the liquid, of course, stays in your body, the blood. But imagine if your blood is really too thick, right? And I'm going to show you with 150 milligrams of glucose in your body, how your kidney will work. Okay, so the sieve is like your kidney. Okay, that's what is filtering your blood, and this blood is going through your kidney, right? You see the liquid is dripping really slow, right? And it's harder for your kidney to work and really filter out all the toxins, other stuff that it doesn't need, right? So let me just clean my hand a little bit. Imagine that happens over years, right? And slowly, that's how your kidney gets damaged. That's how your eyes may get damaged and all that, because if it's not getting the right nutrients to all the different parts of your body, then, you know, you have then health problems, right? Okay, so what can we do, right? How do we know? I'm going to share the screen again. All right, so fasting blood sugar levels, you can see it's 100 or less. And then before meals is, you know, it should be anywhere between 70 to 130. After the meal, after you have a meal, it will go up. Okay, if it's less than 180, that's normal. If it's much higher than that, of course, then that's a problem. Exercise, okay, before exercise, you know, it's below 100, that's ideal. And then by the time you go to bed, you know, if it's between 100 to 140, then that's a normal range. Now, another important part to know if you have diabetes is really looking at your A1C, hemoglobin A1C. If it's under 7.0, all right, And these are important. I'll talk a little bit more why the A1C is so important number to look at and monitor. There are two types of diabetes. The first is called type 1. This is where your body cannot make enough insulin. Insulin is a hormone that is needed for your body to be able to use sugar that are digested from food and use it for energy. This accounts for only 5 to 10% of adults who have diabetes, type 1 diabetes. And type 1 diabetes also tends to affect younger people. And in order to control type 1 diabetes, they would need to take insulin shots. The more common type of diabetes is called type 2 diabetes. This is where the body cannot use insulin properly. And type 2 diabetes can develop at any age, but the good news is that it can be prevented and it can be managed. So it's important to find out early enough, that way you don't develop any serious health problems. And majority of adults, 90 to 95%, have what we call the type 2 diabetes. And there are many reasons why our bodies cannot use the insulin properly, okay? So to kind of give you an example, well, what does it look like in your cells, right? If you can imagine, this is sort of a diagram to let you kind of see how it works in our body. So if our cell, okay, in order for it to take in glucose, which is really, when we eat all the food, especially carbohydrate type of food, it breaks it down into a simple sugar called glucose, where then the cells can use this as energy for us to do all kinds of work, right? And in order for the glucose to enter your cells, it needs the key, insulin, okay? Insulin is like the key, and it actually opens up your cell, and then your cells then can take up the glucose into your body for use. If for some reason your insulin is not working well, it's too rusty or some other issues, right? Then it cannot unlock your cell. And so all the sugar, the glucose, stays in your bloodstream, and then it builds up, okay? So if it's not used, it builds up, and that's why it continues. If it continues to build up, then you develop other kinds of health problems like, blindness or heart problems, whatnot. So this is another sort of diagram to kind of let you see how it works. It's just another representation on the right, So insulin attaches to some receptors, on your cell wall, okay? So it's like the key. So once it attaches, then it opens up your cell, where then all the sugar, like the glucose, can come in and let your cells use it for energy, right? We have to have some sort of energy to keep a body going and for cell growth and all that, right? Now, what causes the insulin to not work well? In other words, what they call insulin resistance. There are a number of reasons. First, it could be, we find that if there's too much fat, too much abdominal fat, and if you're overweight, it can lead to that problem. Lack of exercise, lack of quality sleep. That means if you have insomnia or apnea, that is causing you not to have quality sleep. Another is if you eat too much carbs, especially maybe the wrong type of carbs, just simple carbs. Another potential cause is chronic illness and inflammation. And another is the genetic susceptibility. Diabetes is hereditary, And so if you have family members that have diabetes, your chance of getting diabetes is at a higher risk. So here is a quick poll question I wanted to ask you, and you can stop the video to answer, see what your response is. The first question, how many people in the United States do you think have pre-diabetes? A, 1 in 20, B, 1 in 10, or C, 1 in 3? The second question is, how many people don't know they have diabetes or pre-diabetes? A, 1 in 10, B, 5 in 10, or C, 8 in 10? Again, what do you think is the answer? Write it down. Okay, here is the answer. If you have answered that 1 in 5 don't know they have diabetes, that is correct. Also, about 1 out of every 10 people actually have diabetes. But those who have pre-diabetes, that means they already have early signs of diabetes, is 1 in 3 people. That is quite a bit. And 8 out of 10 people don't know they have pre-diabetes. That is pretty serious, because if they don't know they have pre-diabetes, then the chronic health problems, other things like blindness, kidney problems, those can start happening. And also the ethnicity affects the percentage of people who are at risk for diabetes. Hispanics and also Asian, non-Hispanic, Black, non-Hispanic also have higher risk of getting diabetes. If you wanted to find out if you are at risk for diabetes, you can go to this website and do a very quick risk test. Now I'm going to actually show you those questions on the screen, and you can answer those questions yourself. So if you have your paper and pen, get ready, and then each of you please write down your points, okay, for each of these questions. The first question, how old are you? If you are under 39, you get 0 points. If you are, let's say, 50 to 59, you get 2 points, and so on. If you are 60 and above, you get 3 points, okay? Second question, are you a man or woman? If you're a man, you get 1 point. Woman, 0 point. Third question, if you are a woman, have you been diagnosed with gestational diabetes? That means you have diabetes while you were pregnant, or you have gave birth to a baby that is more than 9 pounds. If the answer is yes, you get 1 point. If the answer is no, 0 point. Fourth question, do you have parents, mother, father, brothers or sisters that is diagnosed with diabetes? If your answer is yes, 1 point. If no, 0 point. The fifth question, have you been diagnosed with high blood pressure? If it's yes, you get 1 point. No is 0 point. The sixth question, are you physically active? What this means is that you are active at least 30 minutes a day. If the answer is yes, you get 0 point. If it's no, you get 1 point. All right, the last question. What is your weight category? That means, are you overweight or not? So you look at the chart on the right-hand side, look for your height, okay? Let's say I'm 5 feet 0 inches. And then find out what is your current weight. If you are between 128 to 152, you get 1 point. So this column, you get 1 point if your weight is in this first column. If your weight is in the middle column, you get 2 points. And then if it's in this last column, you get 3 points. If it's not in this first point column, it's less than the weight here, you get 0 point. Okay, that means if I weigh less than 128 and I'm 5 feet tall, I weigh less than 128, I get 0 points. All right, now you total up all your points and see what your total score is. Do that now. Okay, so you total up your score. If your score is 5 or higher, you are at risk for prediabetes or type 2 diabetes. All right, and when I first was diagnosed with diabetes, I actually scored about 5, okay? But what are some of are there any symptoms, right? Well, before we talk about that, let's understand what these risk factors are, okay? So we talk about family history. If you have family history, it just bumps your risk higher. And then when you get to 60 or older, your risk for diabetes is actually much greater. And that's why you get 3 points, okay, in the risk assessment. And in the risk tool, they didn't put in the ethnic race factor, but that is a small factor. And then the fourth one is, of course, your weight. If you're overweight, that's a big thing. It does affect your risk for diabetes. And then also if you have high blood pressure, again, that's a big risk factor for diabetes. Same thing with if you have low levels of the good cholesterol, which is the HDL, or if your bad cholesterols are too high, it affects your risk factors. If you're not active, okay, just not very do enough exercise, it is a big risk for diabetes. Also, people who have family history or history of heart disease or stroke, if you're smoking, of course, that really increases your risk for diabetes quite a bit. If you have a lot of stress in your life and you're not able to manage your stress, right, that also puts you at risk. People who have depression is at greater risk for diabetes as well as other health problems. And I mentioned for women, if you have gestational diabetes when you're pregnant or you give birth to a baby that's greater than 9 pounds or more, it all puts you at risk. So what are some of the symptoms of diabetes, right? If you know somebody who has diabetes, you might be aware of it. They might they might pee a lot or they drink a lot, right? They might get thirsty. Well, let's see what those symptoms are. In the early stages, some people do get thirsty a lot. They might have dry mouth. They might actually have a big appetite because why? Imagine your cells are not getting the energy that it needs, right? From even though you're eating and the sugar is in your blood, but this sugar, the energy is not getting into your cells for it to use. So you feel like you don't have the energy you need to eat, right? To give you energy. So it's a vicious cycle. And then some people would lose weight a lot, or they might gain weight, okay? Some people have no symptoms at all during this early stage, and that's very common, right? And if the diabetes is not controlled over a number of years, then the symptoms will get more severe, okay? And the person might get headaches, their vision might get blurred, or they get really tired. Okay, imagine you're not getting enough energy, right? So you're tired because your body is not getting the energy it needs to function well. Also, if you have any cuts or sores, it doesn't heal quickly, all right? Some people also get very frequent yeast infections or urinary tract infections. And then When it gets really high, you know, where this blood glucose is really high, people have itchy skin as well. All right. So those are the symptoms. And it's important to know, well, what happens if you don't discover you have diabetes and get it under control, right? There are serious health problems we sort of alluded to earlier, and that is really blindness is one of the biggest things result from undiagnosed and uncontrolled diabetes, or kidney failure, heart disease. Also, people have stroke or they lose their feet or toes. Why? It's because those blood vessels are damaged. They're not getting the nutrients that they need, okay? And they slowly die. And then if you think back about, you know, high blood sugar, right? It's not able to, it's really thick, and it just prevents your body from getting oxygen, proper nutrition to stay healthy. So these are the major health problems from uncontrolled diabetes. And so if your goal for, you know, after you retire or when you retire, you want to be able to travel and do other things, right? Then you want to be able to avoid diabetes, right? Because if you know of anybody who has diabetes, like my mother actually has diabetes that was not diagnosed, and she was not aware of that for several years, because by the time we actually knew, well, there are a number of things why she didn't know. Even though she has blood tests, right? She didn't understand what it means, and her doctor was way too busy. He has too many patients to take care of, so doesn't give enough individual attention to the each client, each patient. So he wasn't really alerting her to say, hey, you need to do this to really get it under control. Otherwise, you're going to have some serious health problems. So by the time that we find out, when I went to a doctor with her, and her blood fasting sugar level was like 300. Okay, that's way too high. In order to get that level high, it has been uncontrolled for many years. And she also developed blindness in one eye because of the uncontrolled diabetes. And you know, by the time she found out, her kidney was also failing. Okay, so all those things kind of come. She has high blood pressure that's not controlled well, and imagine on top of that, right, the high blood sugar. So, you know, she really had some serious problem. For those of you who might know, if you have failed kidney, right, kidney actually is a filter, and if it's not working, we have to go to get, you know, people go to dialysis, and basically dialysis machine helps to clean your blood, okay, and you have to go 3 times a week for over several hours, right, to sit on the machine and then for it to work its thing. And so you cannot be mobile, you cannot go traveling easily, because, you know, who's going to lug the machine with you, right? And so there's prevents you to be able to be independent and do things that you enjoy. And then also you have to watch even more what you eat. You can't drink so much because it's too hard on your kidney to get rid of the excess fluids, and so on. So the moral, you know, of why I'm sharing this is that we have to find out early on if you have prediabetes, and if you do, then take things to control it so that then it doesn't get worse. So, you know, how can we control diabetes, right? So I'm going to share with you some of the strategies, things that we can do, okay? And so let me just mention, first, someone said, well, how can we know how our blood sugar is? If you are, of course, most people take once a year, their blood test, right? You find out if you are diabetic or not, and then if you are If you are diabetic, you take your hemoglobin A1C test, and then for normal A1C, it's under 5.7, okay? So if it's higher than 5.7 and before 6.5, you're pre-diabetic, and then after 6.5, then you're really diabetic. So the previous slide where it says, the A1C should be less than 7, definitely. I would say most doctors nowadays says it should be under 6.5, okay? And so, when I first got diagnosed with diabetes, that was 2 years ago, I was 6.7, okay? And the only reason why I found out that I had diabetes was when I went to get my eye exam, annual eye exam. My doctor had noticed that there's something, in the back of my eyes. It's like there's, she was concerned. So I went to get a further exam where, with the MRI to see what's going on. And then she noticed, she said, you're starting at the beginning stage of retinopathy, which is where you're starting to have blindness, okay? Retinopathy is where your eyes are starting to be, in the retina is being damaged. And so that was a big shock to me. But looking back, it's really because I have so many of the risk factors. I have gestational diabetes, and of course, family history, right? My mother has diabetes. And even though I've been very active, and, over the years, right, I gained maybe a few pounds, less than 10 pounds, but still it made a difference. And the big thing is that I turned 60, okay? So as you get older, even though your body changes and your insulin doesn't work quite as well. And so, it's important to kind of know what they say is knowledge is power. And so, if you understand and know what are some of the risk factors and then do what you can to reduce those, then you can prevent diabetes. Or if you have it, then you can also control it. All right. I will answer some of the questions like how do you keep your blood sugar more stable? We will go into details with that next week because this week, actually, I will talk about how do we, there are some 3 methods that actually help you do that. For people that have diabetes, of course, your doctor will probably give you a glucose meter. Glucose meter is very small, it looks like this, right? And then it has a little lancet, you basically put your finger, and then in the morning, before you have breakfast, you can test your fasting blood sugar level to see how well it's working. So that's how you can kind of manage and control it. But today, let's kind of, I'll share with you some of the methods where you can then, let's say you have some of these risk factors already, okay? Let's say you want to reduce your risk for getting diabetes or pre-diabetes. So if you are actually overweight, okay, and you're not active, by losing a few pounds, as much as 5 to 10% of your overweight, you can actually reduce your risk for diabetes by half, by 50%. That is phenomenal, right? And why that happens? Well, when you're exercising, your body is actually able to use your insulin much better, okay? But let's talk about healthy eating. What do you need to do, right? So if you're overweight, you want to lose weight, you probably hear you want to eat a low-carb meal, reduce the carbs that you eat, right? And that means cutting back on the starchy foods. But starchy foods are not only in grains, right? And a lot of refined pastry, things like that. Even potato has a lot of carbs, right? Yams, corn, rice, of course, pastas, bread, all those have a lot of carb, but not all carbs are the same, okay? So next week, I will definitely go into more detail about the types of carbs and what the glycemic load means. But for now, you know, produce, vegetables, and even some fruits, they're low in carbs, okay? Protein foods, things are like fish, lean fish, poultry, lean meat, dry beans and peas, legumes, tofu, all those are protein. Protein foods have very little or no carbs in it, okay? But on the other hand, we don't want to overeat those too because they are hard on your kidney, okay? It makes your kidney work harder to get rid of the unneeded toxins that are byproducts from protein digestion. So the way to cut back on some of these carbs and lose some weight is that you want to avoid and eat less of these foods that are made with refined sugar, like pastries, cookies, right? Those are tasty, but you want it to really cut back and not have those every day or every week for that matter. And then also cut back on the portions of pasta or white rice that you eat. Substitute with whole grain. They are actually much better. And you'll understand why, you know, when we talk about the complex carbs next week, why they slow down the absorption of the sugar level in your blood. Okay, they because they're digested much slower, they don't raise your blood sugar that high, and so that's why they're beneficial. All right. Now, the other thing to help lose weight is that limit the amount of juices and sugary drinks that you have. So even though 100% juice is healthy, if you drink too much of that, like maybe 2 or 3 glasses a day, those juices have a lot of sugar, okay, and a lot of calories, and they can add up, all right? So I gave you the web address for choosemyplate.gov. Next week, I will go into details as to how much and what types of food are good, but if you want to get a head start, you want to look at that website, you can. At the end of the today's session, I will be emailing the presentation to share with you so you have the information. Now, to lose weight, like 1 pound a week, you have to cut 500 calories a day, okay, to lose 1 pound. Why? Well, if you imagine your weight is like a balance beam, okay, how much you take in terms of calories and how much you burn, how much you use. If you are taking in too much calories, right, like this, then you're going to gain weight because you're not using them enough to really use up the energy. Our body is actually very smart. It doesn't want to waste energy. It's just part of the evolution, right? Evolution-wise, you know, before, people have to forage for food, they have to hunt for food, and so they might not be able to eat for a few days at a time. And so whenever they can get to eat and they have the energy, your body will store it as fat, and then when it's needed, it will then turn the fat into energy for your body to use. So for us nowadays, it's different, right? We can get food much easier, too easy in some ways, right? And sometimes we're eating when we're not even hungry, right? When you are maybe watching TV, you might be snacking on things. So kind of watch where those extra calories are coming from in order for you to then be able to cut out those unnecessary calories. So for example, if you're eating, have dinner and then you're eating late at night, right? Afterwards, you're going to sleep. Well, those extra calories that you're eating during late at night, you're not using, it's going to be converted into fat. And so cutting back a little bit, especially on the high calorie foods that are high in fat, high in sugar, it's an easier way to then lose some weight. But the second strategy, besides watching what you eat, how much you eat, and what type of food you eat, is that you have to do some exercise, okay? And the recommendation is that you have to do at least 30 minutes or more moderate or strenuous aerobic exercise. So if you get into a good habit of going for a walk or going for, going dance at home or do yoga or other kinds of things that you enjoy, then it helps you get into this good habit, and then you can do it doing something fun. Okay, that's the key thing. Because exercise really does increase the effect of how insulin is used in your cells. I certainly note the difference. On days that I'm less active, the next day I can see my blood sugar level goes higher, even though I'm eating correctly. Okay. Also, when you are exercising and you're losing weight, that is a double benefit, right? Because you're also bringing down the excess weight. Your body doesn't have to work as hard. In addition, you're reducing the stress when you are exercising. It makes you feel good, right? And then you are not tempted to then eat out of stress. Or some people eat because they're just have nothing else better to do. So find something to do that you enjoy, to that way, you don't use eating as an activity. Now, the third strategy to control your diabetes and also to manage it better is you have to manage your blood pressure. Again, as we get older, our blood pressure may go up, or if you have a lot of stress, definitely it will go up. All right. So normal blood pressure, systolic, the top number, okay, it should be 120 or below. Okay. If it goes above 120 to 129, it's already considered, elevated. And then stage 1 high blood pressure is 130 and up. And then when you get to 140 and up, that's, stage 2 high blood pressure or hypertension. And then, or if your bottom number, which is your diastolic number, the number that when your heart is resting, if that goes above 90, then you also, that's a diagnosis that you have high blood pressure. So with high blood pressure, that's also genetically related. If you have any family history of it, your chance of getting high blood pressure is increased. So there are lifestyle things that you can do, just as we're talking now, what you eat and your activity level, if you're active or not, and then, helps to control your blood pressure. Because if your blood pressure is too high, and a lot of your blood vessels, your body is very delicate, it can break, right? And then in combination with diabetes, then it's going to, be even more complicated and hard. So these are the 3 things, that you can do. And last month I talked about high blood pressure and what you can do to control it. Of course, not eating things that are really salty, right? Too high in sodium. So looking at seasoning your food with more herbs and other spices that are not high in sodium is definitely one way to help bring your blood pressure back to normal. Also, not eating a very high fat diet, because if it's your diet is too high in fat, then all the excess cholesterol and other fat are not excreted from your body, and you can't get rid of it. Then it builds up in your blood vessels, and then when your blood vessels get built up with these plaque or these fatty tissues, then it can block and raise your blood pressure higher. Okay, so next week we will go into more details and talk about some of the other strategies of controlling and preventing diabetes. And I will go into details about what are some of the healthy carbs and what is the glycemic load. This might not be familiar to you. And it is actually, in the recent years, we have a much better idea of certain foods and how quickly it can raise your blood sugar, okay? And some foods can raise it very slow, which is good, okay? And while other foods actually raise it much quicker, like the foods that are refined, carbs, you know, that are made with white flour, those actually raises your blood sugar much quicker. And then also we'll talk about healthy eating. What are some of the guidelines? How can you prepare a meal that is good for us, good for our heart, good for our, you know, diabetes and blood pressure, and then other cooking ideas. How can you prepare meals that are healthy, that are quick and easy? And then I'll share other resources with you. So that is in store for next week. Thank you for attending the virtual class today on diabetes. You can go to Self-Help for the Elderly's website to look at other virtual classes and their schedule and register for them. Stay safe and healthy.